Hi, I'm Dr. Jack Ringer, and in this video, I'm going to demonstrate on patients how to deliver a local anesthetic to anesthetize either single or multiple teeth painlessly and without collateral lip, tongue, or cheek numbing using the Milestone STA wand. For our patient Heather, we're going to be preparing a lower molar and an upper molar for full coverage crowns. And we're going to anesthetize her using two different anesthetic approaches. For the lower molar, this will be a PDL injection, periodontal ligament injection, which was a controlled injection because the STA wand delivers the anesthetic at 1 drop every 2 seconds, which is below the threshold of pain. So our first injection on the PDL will be in the sulcus on the distal lingual of the lower molar. We will administer the appropriate amount of anesthetic. From there, we will move to the mesial lingual of the same molar, administer the appropriate amount of anesthetic. And then because molars in a lot of cases get innervation from the long buccal nerve or the hyoid nerve, we anesthetize appropriate amount of anesthetic in the furcation area. For the upper molar, we're going to utilize the location known as the AMSA, anterior middle superior alveolar injection, which is an injection given halfway down between the mid-palatine suture and the gingival margin, right between the two premolars. And we will administer the anesthetic there, the appropriate amount. That anesthetic will anesthetize all the teeth from the mesial of the molar all the way to the central on that arch. To complete the anesthetic on that molar, if the AMSA does not create enough anesthetic, we will give a little PDL on the distal buccal of the molar to complete the anesthetic, at which time we can then perform any dental procedure that we like. Heather, I'm going to numb up your tooth right now. We're going to use this little device that's not going to do anything but numb up the tooth itself. Okay, so we're just going to rest this here. And now the machine automatically is anesthetizing you. Okay, and now we're going to, and nothing came out of the needle, so we know it all went into the bone. Okay, one more time. When giving the PDL injection, we also don't want to forget to bend the needle a bit at a 45-degree angle and have the bevel of the needle against the root of the tooth. So when you insert it into the sulcus, it's leaning against the tooth, and with the bend in the needle, the anesthetic is going to flow better down into the periodontal space. So now we're going to give a shot in the furcation to knock out anything from the long buccal or the hyoid nerve. And then you should be totally numb. All right, Heather, I'm going to numb up the top tooth now, and we're going to do it a little different location. We're going to numb you on the roof of your mouth a little bit and then way on the back so you won't get any cheek numbing. And on your lower one, you didn't get any lip or tongue or any type of numbing, right? Perfect. Okay, so here we go. Just going to get a little tiny pinch. You all right? Mm-hmm. When doing the AMSA injection, to keep the discomfort to a bare minimum, a technique, what we call birotational movement, and then I'm slowly moving it into the tissue, the hard palatal tissue. And actually what we're doing is we're slowly doing this and rotating. We're chasing the anesthetic. So the tissue in front of the needle is already numb, and you can see all that blanched tissue on the palate. So the patient is feeling nothing. and it makes this a better experience. So on the upper, if you're going to do PDLs, you start on the buccal aspect. So you can see the tissue all blanched, it's all white. So we know she is pretty well numbed up now. Okay, so Heather, I'm drilling this tooth up here. Have you feeling any pain or discomfort at all? Okay, beautiful. So Heather, when you came in today, what were your expectations being in the dental chair?
Honestly, normally I get high anxiety. I expect pain from the shots, the numbingness. It scares me. So, yeah, I was not feeling great about today.
Is there a history? Was there, as a child, was there pain?
Well, normally the shots cause pain when they're numbing you. And then usually during the procedure, the numbingness wears off and you can start to feel pain again. So I'm always on the edge of my seat waiting for that pain to start. And I did not have that at all.
So tell me your experience today, about your experience.
Overall, my experience was easy. It was painless. I'm really not sure why everyone doesn't use that.
And once you got numb, and like you said, it was painless, did you get any of the typical face, tongue, or lip numbing, either on the top or the bottom?
No, I actually don't even feel like I was numbed at all. If I would have known it would have been this easy, this painless, I wouldn't be in the situation that I'm in today with my teeth issues. I would have been coming to the dentist more regularly. But today was just such a great experience that I definitely will be continuing with my dental work.
So you saw in the video today how we completed 2 preparations on Heather, a lower molar and an upper molar for full coverage restorations. So we used the STA wand to anesthetize her. And in doing so, besides it being a good experience for the patient, it really helps my practice as well on a few levels. One, because the patient is less anxious, they didn't go through any pain, just makes doing the procedure that much easier. And then secondly, which is really a good thing, is I didn't have to worry that when the patient leaves, that their lower lip or their tongue may be numb, or their cheek for the upper, that they may end up biting or damaging their tissue until the numbing goes away. And I know when they leave, they're going to be able to speak normally and go and chew like nothing ever happened. So it just makes for myself, knowing that the patient is a lot happier, makes my experience as a dentist that much nicer.